We've all heard many times about the dangers of tobacco use. Today we're going to talk about how tobacco use can impact your teeth. Joining us once again is Dr. Bruce Goeringer from the Goeringer Family Dental Practice in the Back Mountain. Dr. Goeringer, thanks for being here.
Good to see you, Dave.
Well, when we talk about tobacco use, it's more than just smoking, right?
Yes, there's chewing tobacco, which a lot of young people are starting to use now. They've been using more and more, and it seems to reach a younger and younger age, which is not a good thing.
What are some of the things that smoking can do first? I mean, obviously we know it is very harmful to your health, and it certainly does not leave the mouth unharmed as well.
Well, what smoking does, in the smoke that you take into your lungs and into your mouth, it just bathes your tissues in carcinogenic compounds. It's bathing your tissue in things that cause cancer, which is not a good idea, obviously. It's one of those customary things that's it's been around for hundreds of years as far as smoking, so people still do it, but they don't realize the harm that it can cause. So smoking, in addition to bathing the teeth in carcinogens, it also dries out the mouth and causes root caries, things like that, and it'll cause bad breath. It obviously affects the lungs, and the smoke itself affects the soft tissue in addition to the teeth.
And tell us a little bit more about chewing tobacco. You mentioned it's a rising issue between teenagers right now. How does that have an impact on your gums and teeth?
Well, again, it bathes those tissues in carcinogens, and these are cancer-causing agents. A carcinogen is a cancer-causing agent, and that's the last thing you want. When you're 13 or 14 years old and your friends are trying this chewing tobacco, there's peer pressure to do it. We always encourage our patients not to get trapped into this, because once you start the chewing tobacco, it is somewhat addictive, and they tend to continue using it more and more. It's popular among baseball players, so the young kids will see the baseball players chewing tobacco, and they'll say, well, I want to be just like this guy that's hitting 350, has a 350 batting average, or this pitcher that's 20 and 5, and they'll try the chewing tobacco too, just because of peer pressure and pressure from seeing the professional athletes doing this.
And the issue is, if you continue the use, you mentioned bathing your gums and teeth in carcinogens, we could be talking about oral cancer and significant injury or worse.
It's surprising. A lot of people think that smoking is the real problem. Chewing tobacco is really equal. And when you have a problem from chewing tobacco, you get cancer from chewing tobacco, you could have serious deformities to your face and your neck and your skull. People have lost half their jawbone or their whole jawbone because of oral cancer. And the first step is using this chewing tobacco or snuff or the oral tobacco.
All right, sounds like we should avoid it for sure. Dr. Goeringer, how can our viewers get in touch with you if they'd like to set an appointment?
Well, my website is drgoeringer.com. My phone number is 570-675-3646.
All right, Dr. Bruce Goeringer from Goeringer Family Dentistry in the Back Mountain. As always, thanks for being on the show.
Great to be here again. Take care.